Most people over the age of 60 wake up every morning with a familiar stiffness in their lower back and quietly accept it as a normal part of aging. But what almost no one tells you is that this stiffness is not a sign that your spine is broken, worn out, or beyond help. It is a sign that your spine has been quietly compressed for years and simply hasn't been given a chance to recover. Right now, as you're watching this, gravity is pulling your body downward, pressing each vertebra gently but constantly into the one below it, squeezing the soft discs that act like cushions between the bones. And after 60, those discs don't bounce back automatically the way they once did. The shocking truth is that many people lose up to an inch of height throughout the day just from normal standing and sitting. And that loss of height is not just cosmetic. It is pressure, tension, and irritation building inside the spine. Here's the part that most doctors never explain clearly. Pressure is reversible, and when pressure is relieved, pain often fades faster than you'd expect. That's why a simple 90-second daily decompression can feel more powerful than weeks of stretching, medication, or forced exercise. If you've been told that your back pain is permanent, that it's arthritis, degeneration, or just your age, stay with me, because by the end of this video, you'll understand why so many people over 60 experience relief, not by strengthening harder or stretching deeper, but by allowing their spine to gently lengthen again. Back pain after 60 is rarely about weakness alone. It is about compression, fear, and tension stacking up over time. And when you address compression first, everything else begins to work better. Think about how your day actually unfolds. You wake up and your back feels stiff but manageable. You stand, you walk, you sit, maybe you drive, maybe you spend time in the kitchen or at a desk. And hour by hour, gravity quietly does its work. By the afternoon, there's a dull ache. By evening, bending feels heavier, standing feels tiring, and sometimes the pain creeps into the hips or down the legs. This is not because your back is failing you during the day. It's because your spine is getting shorter and tighter. The discs between your vertebrae are like sponges. When you lie down and unload the spine, they absorb fluid. When you stand and sit all day, that fluid gets pressed out. If that fluid isn't restored regularly, the discs become stiff, flattened, and irritated. And nerves that pass between them become sensitive. Many people try to fix this the wrong way. They stretch aggressively, thinking tighter muscles are the problem. They force movements, twist, or bend deeply, hoping to loosen the back. Others avoid movement altogether, afraid they'll make things worse. Both approaches miss the core issue. A compressed spine doesn't need force. It needs space. And space is created not through strain, but through positioning, relaxation, and time under reduced load. This is where decompression comes in. And I want to be very precise about what that word means, because it's often misunderstood. Decompression does not mean hanging upside down, using expensive traction machines, or pulling on your spine. Those methods can actually be risky after 60, especially if you have disc thinning, osteoporosis, or joint instability. True decompression is gentle. Unloading, it's allowing gravity to work for you instead of against you, and it works best when the nervous system feels safe enough to let go. The spine is not just a mechanical structure. It's deeply connected to your nervous system. When your brain senses threat or instability, it tightens the muscles around the spine as protection. This is why fear and pain are so closely linked. If you've ever noticed your back tightening when you're stressed, anxious, or rushed, that's not a coincidence. Chronic tension increases compression. Decompression reduces it, but only if it's done in a way that doesn't trigger guarding. This is why 90 seconds can be enough. When you position your body correctly and breathe slowly, the muscles surrounding your spine begin to relax within seconds. As they relax, pressure on the discs decreases. Fluid begins to move back in. Nerves calm down. The sensation of stiffness eases. You're not fixing everything in 90 seconds, but you are giving your spine a daily reset. And those resets add up. One of the safest and most effective decompression positions for people over 60 starts on the floor or a firm bed. You lie on your back and place your lower legs on a chair, couch, or bed, so your hips and knees are bent at about 90 degrees. This position alone reduces the natural arch in the lower back, just enough to relieve pressure without forcing it flat. Your arms rest comfortably by your sides or on your stomach. Your jaw is relaxed. Your shoulders are heavy. And then you breathe. Breathing is not optional here. Slow breathing through the nose, letting the belly rise on the inhale and soften. On the exhale, tells your nervous system that it's safe. On each exhale, imagine your lower back melting downward. Not pushing, not forcing, just releasing. Many people feel relief in the first 30 seconds. Others feel it after a minute. Some don't feel much at first, but notice later that standing feels easier. All of these responses are normal. Another gentle decompression movement involves bringing one knee toward the chest while lying on your back. This should never be forced. You hold behind the thigh, not the knee, and you bring it in only as far as it feels comfortable. You breathe slowly for 15 to 20 seconds, then switch sides. If it feels good, you can bring both knees in together for a brief moment. This movement opens space between the vertebrae and can ease pressure on nerves. But the key is gentleness. Pain is a signal to stop, not push through. Consistency matters more than intensity. 90 seconds every day is far more effective than 10 minutes once a week. Think of decompression like hydration. You don't drink water once a week and expect to feel good. Your discs need regular unloading to stay healthy. When decompression becomes part of your daily routine, many people notice their baseline pain decreases, their stiffness improves, and their confidence in movement returns. Fear is one of the biggest hidden drivers of back pain. Many people have been told their spine is fragile, that degeneration means damage, and that pain equals harm. In most cases, that simply isn't true. Age-related changes are normal, and many people with significant degeneration on scans have no pain at all. Pain often comes from sensitivity, not damage. Gentle decompression reduces sensitivity by reducing pressure and calming the nervous system. As you begin to decompress daily, you may notice changes beyond pain relief. Walking may feel lighter. Standing may feel less tiring. Sitting may feel more comfortable. Even sleep can improve because your nervous system isn't stuck in a protective state. These changes happen not because you forced your body, but because you gave it space to recover. It's also important to know what not to do. Avoid aggressive twisting to crack your back. Avoid hanging exercises if your shoulders or grip are weak. Avoid forcing stretches that cause sharp pain. These approaches can increase irritation and instability. Decompression should always feel safe, supported, and controlled. Your spine needs space just as much as it needs strength. After 60, creating that space becomes essential. When you respect your body's signals, move gently, and decompress daily, you're not just managing pain, you're restoring function and confidence. As you continue listening, I want you to shift your mindset slightly. Because one of the biggest mistakes people over 60 make is thinking of their back pain as a single problem that needs a single fix. In reality, back pain at this stage of life is usually the result of many small stresses adding up over time. And decompression works so well because it gently addresses several of those stresses at once. It reduces mechanical pressure, calms the nervous system, improves fluid movement in the discs, and signals safety to the muscles that have been guarding for years. When all of those things happen together, even briefly, the body responds in a powerful way. Let's talk more deeply about compression, because understanding it removes a lot of fear. Compression is not inherently bad. Your spine is designed to handle load. Walking, standing, even lifting within your limits are all healthy activities. The problem arises when compression is constant and uninterrupted. When you sit for long periods, especially with a rounded lower back, the discs in your lumbar spine experience more pressure than when you stand. When you stand for long periods without movement, gravity continues to press downward. Over time, without regular unloading, the tissues adapt to this compressed state. Muscles shorten, discs lose hydration, and joints become less tolerant of movement. Pain is the body's way of asking for change, not rest forever. This is why people often feel better lying down. When you lie flat, the spine is unloaded and pressure decreases. But simply lying down isn't always enough, especially if tension remains in the muscles or the nervous system is still on high alert. Where intentional decompression positions make a difference. They guide the spine into a position where pressure naturally reduces and relaxation is encouraged. Many people worry that lying on the floor will be uncomfortable or unsafe. If the floor feels too hard, a firm mattress works just as well. The key is support, not softness. A very soft surface can allow the body to sink unevenly, which may increase tension. A firm, supportive surface allows the spine to rest in a neutral, decompressed position. As you lie in the decompression position with your legs elevated, pay attention to small details. Notice whether your jaw is clenched. Notice if your shoulders are creeping toward your ears. These are signs that your body is still holding tension. Gently allow those areas to soften. You are not doing anything wrong if it takes time. For many people, especially those who have lived with pain for years, relaxation itself is a skill that needs to be relearned. The breath plays a critical role here, and I want to expand on that because it's often overlooked. When you breathe shallowly, mainly into the chest, your body stays in a mild state of alert. This keeps muscles slightly tense. When you breathe slowly and deeply into the belly, you activate the vagus nerve, which shifts your nervous system toward a state of rest and repair. This shift alone can reduce pain sensitivity. During decompression, Try counting a slow 4-second inhale through the nose, followed by a 6-second exhale through the mouth. The longer exhale is especially calming. You may notice subtle sensations. During decompression, some people feel warmth in the lower back. Others feel a gentle stretching sensation. Some feel nothing at all at first. All of these are normal. The goal is not to chase a sensation, but to allow the process to happen naturally. Think of it as giving your spine permission to rest. Now let's address a very common concern. What if you have arthritis, disc degeneration, or a history of back problems? These conditions do not automatically mean decompression is unsafe. In fact, gentle decompression is often one of the safest ways to reduce discomfort associated with these conditions. What matters is avoiding force. You are not pulling your spine apart. You are simply reducing the load it carries. It's also important to understand that pain does not always mean damage. Many people have imaging scans that show disc degeneration, bulges, or arthritis, yet they have little or no pain. Others have significant pain with minimal findings on scans. Pain is influenced by sensitivity, inflammation, stress, sleep, and fear. Decompression helps by reducing one of the major contributors, mechanical pressure. As you practice daily decompression, you may start to notice patterns. Perhaps your pain is worse on days you sit longer. Perhaps stress makes it flare up. These insights are valuable. They allow you to make small adjustments throughout the day, such as standing up more often, changing positions, or doing a quick decompression session in the afternoon or evening. 90 seconds is a starting point, not a limit. Some days you may want to stay in the position for 2 or 3 minutes, especially if it feels good. That's fine. The key is that it never becomes forced or uncomfortable. More is not always better. Gentle and consistent is better. Now let's talk about what happens when decompression becomes a daily habit over weeks and months. The discs begin to retain fluid more effectively. This doesn't mean they return to a youthful state, but they become healthier and more resilient. Muscles that were chronically tight begin to lengthen and relax. Joints move more smoothly. The nervous system becomes less reactive. Many people report that they feel more confident bending, walking, or standing because they trust their back again. This confidence is not trivial. Fear of movement can be just as limiting as pain itself. When you fear bending or walking, you move less. When you move less, your body becomes stiffer and weaker. This creates a cycle that reinforces pain. Decompression helps break that cycle by providing a daily experience of relief and safety. It's also helpful to combine decompression with gentle movement later in the day. After decompressing, your spine is more receptive to movement. A short walk, light stretching, or simple daily activities often feel easier. This is not the time for aggressive exercise, but it is an ideal time for natural movement. Let's address sitting posture, because it plays a huge role in daily compression. Sitting with a rounded lower back increases pressure on the lumbar discs. You don't need to sit ramrod straight, but supporting the natural curve of your lower back can significantly reduce strain. A small pillow or rolled towel placed behind the lower back can make a noticeable difference. Changing positions frequently is even more important than perfect posture. Standing posture matters too. Locking the knees and arching the lower back excessively increases compression. Standing with soft knees and a relaxed posture allows the spine to distribute load more evenly. Again, this is not about rigidity, but balance. Sleep is another important piece of the puzzle. If you wake up with back pain, it may be related to how your spine is supported at night. Side sleepers often benefit from a pillow between the knees to keep the spine aligned. Back sleepers may benefit from a small pillow under the knees. These small adjustments reduce overnight compression and complement your daily decompression routine. As we move deeper into this topic, I want to emphasize patience. The spine responds to what you do most often, not what you do occasionally. Daily decompression sends a consistent message of care and support. Over time, that message reshapes how your body feels and moves. You may have days when your back feels worse despite doing everything right. This doesn't mean decompression isn't working. Pain can fluctuate due to stress, sleep, weather, or activity levels. What matters is the overall trend. Most people who commit to daily decompression notice that flare-ups become less intense and less frequent. It's also okay to modify the approach. If lying on your back with legs elevated is uncomfortable, you can try lying on your side with a pillow between your knees and focusing on slow breathing. The principle is the same. Reduce load, encourage relaxation, and allow space. Remember, the goal is not to eliminate all discomfort overnight. The goal is to create a daily habit that supports your spine's natural ability to heal and adapt. When you do that, improvement follows. In the next pod, we'll continue exploring how to integrate decompression into your daily life, how to avoid common mistakes that slow progress, and how to know when you're truly helping your spine versus unknowingly aggravating it. Teeth or washing your face. When decompression is treated as an occasional fix, the benefits are temporary. When it becomes a daily ritual, the spine begins to expect relief, and that expectation alone reduces tension. One of the most common questions people ask is when the best time to decompress is. The honest answer is that there is no single perfect time. Morning decompression can help reduce stiffness and set a calmer tone for the day. Evening decompression can release the pressure that is built up from hours of gravity. Some people do both, and even then, they keep it gentle and short. The body responds best to regular unloading rather than long, infrequent sessions. It's also worth discussing how mindset affects results. If you approach decompression with impatience or frustration, the nervous system remains slightly activated. If you approach it with curiosity and calm, the body relaxes more readily. This doesn't mean you have to force yourself to feel relaxed. It simply means allowing the experience to be what it is. Over time, relaxation becomes easier. Let's talk about progress. Because progress after 60 often looks different than people expect. Progress might mean that your pain doesn't disappear completely, but becomes less intense. It might mean you recover faster after activity. It might mean you feel more confident moving, even if some stiffness remains. These are meaningful changes. They indicate that your spine is becoming more resilient. Many people, unknowingly, sabotage their progress by doing too much too soon. They feel a bit better and immediately return to old habits or add intense exercise. This can reintroduce compression faster than the spine can adapt. It's not that exercise is bad, it's that timing matters. Decompression first, gentle movement second, and gradual strengthening later is a much safer progression. Another common mistake is ignoring pain signals. Pain is not the enemy, but it is information. Sharp pain, increasing pain, or pain that lingers long after an activity is a sign to slow down and reassess. Gentle decompression should never increase pain. If it does, the position needs to be adjusted or stopped. It's also important to acknowledge emotional factors. Stress, worry, and frustration can all increase muscle tension and pain sensitivity. Many people notice their back pain flares during stressful periods. This doesn't mean the pain is all in your head. It means the nervous system is involved. Decompression, combined with slow breathing, directly addresses this connection. As you become more familiar with decompression, you may start to notice subtle improvements in your posture without consciously trying. When pressure decreases and muscles relax, the body naturally finds a more balanced alignment. This reduces strain during daily activities and further supports recovery. Over time, many people report that decompression becomes something they look forward to. It becomes a moment of quiet, a pause in the day where the body is allowed to rest. This mental association enhances its physical benefits. It's also worth mentioning that decompression does not replace medical care when it's needed. Severe pain, loss of strength, numbness that worsens, or changes in bladder or bowel control require medical attention. Decompression is a supportive practice, not a substitute for diagnosis or treatment when red flags are present. As weeks turn into months, the cumulative effect of daily decompression can be significant. Reduced baseline pain, improved mobility, better sleep, and increased confidence are all commonly reported. These changes often happen gradually, which is why consistency is so important. Let's revisit the idea of 90 seconds. Because by now, you can see that it's not about the number itself. 90 seconds represents something achievable, something that removes excuses. It's short enough that you can do it even on busy or difficult days. And yet, when done daily, it's long enough to create meaningful change. Your spine is adaptable. At any age, it responds to how you treat it today, not how it was treated decades ago. Gentle decompression sends a clear message of care and support. Over time, the spine responds by becoming less sensitive and more functional. As we move toward the end of this discussion, I want to summarize what matters most. Back pain after 60 is often driven by daily compression, muscle guarding, and nervous system sensitivity, not irreversible damage. Gentle spinal decompression reduces pressure, encourages disc hydration, and calms the nervous system. When practiced daily, even for as little as 90 seconds, it can create noticeable improvements in comfort, mobility, and confidence. Avoid forcing movements, listen to your body, and prioritize consistency over intensity.